Thank you. Thank you for allowing us to present today. Today we're going to talk about our LightSight 3B extension study, the preliminary top-line results. It's an open-label, prospective, multi-center extension of the LightSight 3 trial, which was our pivotal trial that led to FDA authorization last November of 2024. So this is a follow-up study. If we can advance it. There we go. So just a reminder, we did a 2-year study in the LightSight 3 where we randomized patients either into a sham or an active treatment. We showed improvement over the course of 3 rounds of treatment every 4 months to get about a 5 to 6 letter gain. That was our modified intent to treat mean, and that was maintained for out to 2 years. At the end of 21 months, that was our 6th round of treatment, and then an exit at 24 months. So the current study extends that, and it's partially supported by a small business incentive grant from the National Eye Institute. Unfortunately, that grant was funded and then it got delayed. So we ended up having a washout period for about 20 months between the end of our LightSight 3 trial and the beginning of our LightSight 3B trial. The only qualifications were patients had to complete the LightSight 3 trial. Everybody got PBM with the active dose, so the shams could cross over and get treatment after 2 years. We thought that was the ethical thing, and we could continue to treat the patients for another 4 rounds of treatment. The other thing is that we allowed the other eye in. If it did have GA, we took off the restrictions on no center involving GA. So some of these patients, by the end of the 2 years, had progressed, particularly in the sham, to GA, and some of them further progressed over 2 years. So we're going to talk about today BCVA, but we also are collecting a lot of the anatomical data, including incident progression to GA, VFQ, central drusen, EZ, atrophy, GA lesion growth, and contrast sensitivity. So ultimately, we had 63 eyes in this study. Some subject demographics are here. I just want to point out that these patients typically came in at the beginning of the LightSight 3 trial at 5.5 years after onset or diagnosis. We're now looking at patients for another 4.5 years over the 2 trials, so we've been following these for 9.5 years. The risk factor on the Ferris scale showed some increase over the course of time, and now we're looking at very high to moderate risk for progression in these patients at 3.4 to 3.5 risk factors out of a total of 4. So the breakdown was 39 patients got PBM early and continued. Obviously, everybody got PBM in the second group. 15 were sham. We did have non-study eyes that qualified, and we won't talk about those today, but we did allow those in as well. The big issue here, obviously, is we have an interim of about 600 days. And as you can see on the BCVA, the PBM group that started at LightSight 3B baseline was still at 74.8 letters, and the sham group, as they had lost over the LightSight 3 study, and then with 20 more months, they continued to show some progression. So while we randomized at the beginning of the first trial, they're not randomized, and there is a difference going in, so we'll talk about that in a few slides. Here's what happens to the PBM group. As you can see on the left part of the graph, you see the increase over the original trial. Then in the 20 months, we start to see a loss of BCVA, consistent with about 20 months and about 3 letters overall from the high key point at month 21 where it was approved and had about a 6-letter gain. But when we came in and retreated them, we saw recovery of function that was maintained. So we actually got back to a greater than a line of benefit with 4 more rounds of treatment. Interestingly, if you look at the sham group, you can see in that interval there was a larger progression of vision loss. Indeed, they went to about a -4 to 5 letter score. We did see some stabilization when they continued treatment, but it didn't fare as well, at least overall, as it did in the PBM group. However, we do want to look at a couple things. The 20-month interim means that our PBM group actually maintained still a 3.5 letter gain from the 6.2 at the end of the treatment in the LightSight 3 pivotal trial, where the sham groups continued to lose vision and end up with a -4.5 letters at baseline of the LightSight 3B. You can see down in the bottom left, though, there was a significant difference in the geographic atrophy. So in the PBM group, there's about 25% of these patients that have progressed to geographic atrophy, where in the sham, a lot more progressed at the end of light sight 3, and we continue to see progression. So obviously, we don't have an equal mix between these two groups. So we looked at how that impacted. And basically, if you look at the two groups, the 39 eyes in the light sight 3B, if you separate them, because whether they have GA or not, as you might expect, you see more vision loss in those patients that have progressed to GA. Though you see some variation, we had 2 significant patients that lost a lot of vision over the course of the interim and early in the light sight 3B study. So if you remove those, we actually see that both the earlier GA patients and the no GA patients show a very nice response. However, if you lose a lot of central viable tissue, there's nothing that we can do. Interestingly, overall in intent to treat, we saw in the light sight 3 about 60% of the patients got at least a line benefit, 20% got 2 lines, and that was equivalent seen in the extension study. And finally,
can you summarize so we can ask a question or two?
Finally, the sham group showed the same thing. GA patients lose more. No real side effects in here, the top line. We are maintaining BCVA. We can get it back to a line, and very safe, and repeated treatments look good out to 4.5 years. Okay?
So you did see some modest to some significant visual gain in this population. And again, so on the definition of the dry AMD you have in this study, how would you explain the vision gain here?
Well, obviously these patients have significant pigmentation changes, about 50% at the beginning of light sight 3. They have a fairly high drusen load. So we do see some patients that have very good vision, 70% were greater than 20/40 vision. But over the course of 2 years, you saw some of them progress. And particularly with incident of GA, more of those patients progressed in the sham versus the, and so we continued to see vision loss as you progressed.
The anatomic findings are really interesting. You can't bias those with effort. The fact that this was randomized, sham-controlled, active sham-controlled with different lower intensity wavelengths, I think is powerful. You've got quite a commercialization challenge ahead. There are a lot of patients with AMD. Congratulations on your approval.
Thank you very much. We're very excited for the patients, and thank you for inviting us here.